My name is Ariana Sedaghat, and the following is a quick video on base excess. For all concentrations of hemoglobin, base excess is the amount of acid that needs to be added to 1 liter of fully oxygenated blood in order to return the sample to standard conditions. Understanding this concept may be easier after learning the history behind it. Two PhD docs wanted to quantitatively describe metabolic acid-base disturbances and came up with the idea of using a buffer base to do so. The buffer base is the amount of base that would either need to be added or removed in order to bring a patient back to standard conditions from a metabolically deranged state. Thus, a negative base excess indicates a metabolic acidosis, while a positive base excess indicates a metabolic alkalosis. Let's talk through an example. Anesthesiologists will often obtain arterial blood gases throughout a case. If deranged, base excess values are more likely negative in the OR. Acidosis during surgery is usually due to a buildup of lactate, which can either be due to A, poor cardiac output, or B, poor oxygen extraction by the tissues during surgery, both of which can be caused by vasodilation, third spacing, volume loss, etc. So why is etiology important? We're taught by standardized tests that in the OR, a negative base excess value indicates hypovolemia. However, we now know that a base excess on ABG can either be due to distributive, cardiogenic, or hypovolemic processes. Treating a negative base excess with fluids may help the values normalize if the etiology is hypovolemic, but as we discussed, the base excess can also be negative due to vasodilation, which would require pressors, or poor contractility, requiring inotropes. Figuring out the processes driving base excess is where advanced hemodynamic monitoring systems such as the TEE, esophageal Doppler, or the Cheetah can come in handy, as they put the patient's entire hemodynamic picture into context. From there, you can use the patient's acid-base status, values such as cardiac index, mean arterial pressure, stroke volume, as well as your knowledge of physiology to determine what is going on with your patient and how you should best manage them.